issues 5 recommendations to establish an effective prevention and control system for infectious disease in Malaysia and South Korea as follows. First, the surveillance systems and early detection systems against the large-scale transmissions should be strengthened. Second, systematic analysis on COVID-19 etiology and appropriate response based on evidence are necessary. Third, evaluation of government response measures and preemptive implementations are necessary. Fourth, health equity and the protective measures designed for socially disadvantaged should be strengthened. Fifth and last, healthcare infrastructure designed to counter emerging infectious disease should be prepared in advance, and the government response capacity should be reinforced. Based on analysis of the two countries' capacity on public communication and citizen participation for trust building and inclusive society, the following 4 policy insights could be drawn upon. First, active citizen participation and effective risk communication would enable a more inclusive society. Second, the government and society should become more human-centric with rapid digital transformation toward data-driven governance. Third, the government should seek to become more innovative, agile, and adaptive along with a whole-of-society approach and among solidarity-based communities, local governments, and civil networks. Fourth and last, future policy implementation should foster strategic foresight and continuous learning that ensure optimized behaviors and solutions for future complications. Information communications technologies has been an immense support to the National Infectious Disease Framework. 3T, test, trace, and treat for data collection and management, epidemiological tracing, as well as non-face-to-face treatment. One of the key implementations of the 3T approaches in collaboration with the private sector is done through the development of a global epidemic prevention platform in partnership with Korea Telecom using telecommunication data. Lessons learned from the responses to COVID-19 tell us that to successfully implement ICT-based NPI against the future pandemics, it is necessary to induce efficient and rapid responses through the establishment of active public-private partnership. Korea, relatively successful response to COVID-19 pandemic, supported in significant part by a strong and efficient public healthcare system, shows that carefully sequenced and incremental approaches help to improve affordability and overcome political headwinds. The short-term policy option for Malaysia's healthcare financing calls for specific public health insurance for COVID-19, which will transition into a long-term public health insurance scheme. This has the advantage of utilizing the existing demographic database accumulated by private insurers, as well as the expertise in calculating insurance premiums. Yet, public health insurances and private hospitals can gradually expand their markets while maximizing the risk-playing effects. As emphasized in each chapter, the government should develop the necessary ICT infrastructure and re-establish legal systems and strategic public-private partnerships to construct national-level data-driven administration system and predictive innovation governance for COVID-19 and other new infectious diseases. There is urgent need for innovating governance structure and changing the way they work for the public and the private sector to responsibly and timely collect, access, share, and use data. It is also of paramount importance that a vision is established at the national level with a clear policy regulatory framework to increase the capacity to respond in crisis through the utilization of data and ICT. These efforts should not be limited to the national level, but expanded to the entire region of Asia Pacific, where these two countries belong. Furthermore, it should be emphasized that in addition to responding to infectious diseases, data-driven and ICT-based transnational innovation network will foster the creation of an ecosystem, and joint response structures will enable agile, accurate, and anticipatory decision-making to promote sustainable development in the related economic, social, and environment domain. Thus, it is expected that this study will provide a significant basis for the future management of the change and challenge in the interregional terrain.